Welcome to the special Be the One series of the Tango Alpha Lima podcast. I'm your host, Amy Forsythe. At the American Legion, we dedicate the first day of each month as a time to raise awareness of our Be the One initiative to prevent suicide within the veteran community. In support of this, I've joined the Tango Alpha Lima team to bring you a bonus podcast episodes featuring guests who will provide expertise, resources, peer-to-peer support, and inspirational stories focused on saving veterans' lives. You can learn more about this at the betheone.org website, but for now, let's start the conversation with today's guest. Our first guest in this series is Waco Hoover. Waco is a Marine Corps veteran, co-owner of Veteran Entertainment Television, advisor to Founders Factory, a London-based venture capital firm, managing partner of Experiential Group, and serves on the board of Irreverent Warriors, a nonprofit preventing veteran suicide. He's currently the chair of the Be the One initiative for the American Legion. So welcome to this very special first edition of Be the One podcast. Hello, Waco.
Hi, Amy. It's great to be here.
Oh, wonderful. Thank you so much for joining us. We are so excited to start off this series with you as a special guest because there's a lot of exciting things happening, and you're really now at the forefront of the American Legion's initiative with Be the One. We've kind of rolled it out, and now we're going to do a deep dive and talk more about where you've come from and, really the future and the vision for this initiative. But first, let's talk a little bit about your military background. You and I both served in the Marines. And so take us back to, your early days, or what led you to join the Marine Corps.
Yeah. So I was an infantry Marine, and my family, my grandparents, my father all served in the military. Grandparents, World War II, father, Vietnam, did 2 tours in Vietnam with the 82nd Airborne, and that definitely left an indelible print on me, my family, and so much of the work that I'm really passionate about doing now because of that experience with my father growing up, in the household of a Vietnam veteran who dealt with a lot of the things that Vietnam veterans, dealt with. And but for me, I think when I was in high school thinking about what I wanted to go on and do next, I got into several colleges, and for me that big adventurous spirit just kind of kept tugging at me. And I literally, as a young person, which looking back on it now, it sounds completely silly, but I was like, I wanted to go blow shit up, which is the most cliche thing I know. But that was, I guess, 26 years ago now, when I was noodling on, going into the Marine Corps, and ultimately did as an enlisted Marine. And so that was, a big part of it. My mom jokes that if my brother and I grew up like back in the day, we would have been Vikings. I'm not sure how I should take that, Mom, but we'll take it as a compliment.
Well, wonderful. I mean, your service didn't stop with you joining the Marine Corps and serving as an infantry Marine. Where were you stationed while you were in the service?
Yeah, we were stationed in Okinawa and Hawaii with 3rd Battalion, 3rd Marines. So good
Okay,
old camp,
America.
yeah, NTA and all the Kaneohe Bay.
Yeah, America's Battalion, right? Is that what the naming of it was? Well, it's been a long time since you left active duty in 2001, and you've made your career and your life of service a passion project, and you're involved in so many things. And it's no surprise and no coincidence that now you've partnered with the American Legion to talk more about Be the One, preventing veteran suicide, but all the other strategic partnerships that you have. Let's talk about Be the One, and really what's fueling this passion for combating veteran suicide.
Sure. Well, going on, I think 6 or 7 years now, I've served on the board of Irreverent Warriors, which is an amazing organization that that pulls together about 15,000 veterans all over the country for hikes, with the goal of facilitating social connections. Social connections save lives at the end of the day. And so it's always been something that's near and dear to my heart, for some of the family reasons that I mentioned, legacy family reasons, but also just having lost, close friends like many of us have. But the Be the One, I think, is such a special program because it's so, the elegance is in the simplicity. All of us just need to be the one to have our eyes open and our ears to the ground for someone who might be struggling or someone who's in need. And the reality is that none of us live within the confines of a military base or the VA. Once you transition out, we operate in our communities. We're a husband, we're a coworker, we're a coach, for Little League or whatever it might be. And, you know, for us to make sure that we are cognizant of what some of those signs can look like, again, being the one, is really how, at the end of the day, we're going to make a dent in suicide prevention and really prevent, what's been happening for the better part of 20 years. And the real tragedy is that we've kind of been doing the same thing over and over again for 2 decades plus, and we all know what the definition of insanity is. It's doing the same thing over and over again and expecting a different result. And so Be the One is about flipping that narrative and that script and really start to be unconventional and thinking about how we can do things differently to finally solve this epidemic.
Well, with someone like you to be that voice and that influencer to bring people together to open up the discussion about what are some of those triggers, what are some of those pivot points that we can make to change people's mindset. And so here on this podcast, we're talking to subject matter experts and people that have tools and tactics and ways and facilitate for veterans to come and talk, or methods that have shown success. And can you talk about the strategic lineup for Be the One, maybe the first phase, second phase, and where you really want to see, what's the vision for the future?
Yeah, so if you think about Be the One, the first stage of it over the past year and a half, 2 years, has really been about creating awareness around the stigma, and that really drills down to the culture of the military. Anyone who's served or military adjacent, as we like to say, understands at some level that weakness is not smiled upon in the military. It's suck it up, mission accomplishment, and that's great for combat readiness, but it's not great for transitioning out and having a happy, healthy, productive life, being a great husband, a great father, or a brother or sister, or whatever it might be. And so that's a huge part about how we need to approach this differently. And so, thinking about what's next. So stage two is, I think, really amazing because what we did a phenomenal job on creating awareness in the partnership with Chip Ganassi Racing and IndyCar. And wow, they're having a hell of a year so far, which is really, really amazing, which just amplifies, what we're thinking about around, eliminating the stigma and allowing people to ask for help, which is obviously a huge part of that. So we're going to continue to lean into the destigmatization of asking for help in a really big way. But the next step is we're evaluating what key industry leaders we want to partner with in that capacity. We're looking at what lifestyle brands we want to partner with on that, and then also who are the key, I'll use the term influencers within our community. Who are the key thought leaders that men and women look to and respect, and who should we be aligned with to accomplish that? So we're doing an extensive amount of research, and we're also looking for other suggestions from our community about how we can do that and who we should be aligned with. So that's a huge part of it. And when we talk about culture, I think we'd all agree that culture is the most powerful change agent. And we need people that we aspire to be, or that we respect, and we hear from, we read their books or we watch them on TV. Having those individuals that are in the military community, hearing from them and talking about how it's okay to raise your hand and ask for help. It doesn't mean you're being weak. It actually means it's the strongest thing you could ever do to save your life and help your family. So that's going to continue to be a huge emphasis for us.
Well, what types
Another
of
big,
Yeah.
please.
Oh, well, what kind of success stories have you been seeing with these strategic partnerships and a real momentum building around not just Be the One, but really mental health as a whole? Can you talk about some of those successes that you've seen and just in the years that you've been working on this, you've probably come across people that have like opened their eyes and then say that I want to help. What can I do? And how does that look?
Yeah, so a couple examples there. One is at one of the IndyCar races earlier this year, there was a gentleman who approached the team and said, "Hey, this Be the One really resonates with me. I am struggling. I need help." And we were able to get him the appropriate resources that he needed at that time, and it's made a huge difference. And that's an example of someone who, we don't know what timeline they were on or what was really going on in their head. And it's a great example of resources, awareness, and visibility, so that people understand that you're not alone. It comes down to that social connection piece. You don't know when you text a friend or you call somebody you serve with, how that precise moment but might be the moment that they needed to pull them out of the dark place that they're in, and just to feel engaged again, or feel like they do matter, and the world is not going to be a better place without them. So that's something that I think is really compelling. And stage two, of Be the One, is really about how we try to measure that, and also how we work with other organizations to make sure that more people, like I said, have their eyes and ears open, who can really help with some of those things. You don't know what you don't know, and so if you don't know how to look for those risk factors that are there, it's really challenging. The other piece of that I'll say is that this is not limited to the military community as a problem. If we sit here, and I think this is part of the reason why there's been a challenge with this issue up until this point. There's many reasons, but one in particular is that the broader American public needs to know about this issue and about this problem. And it's easy to hear about 22 a day, but it's when it's personal and it's real and it hits home. We have to have a conversation about this issue and this topic. And like I said earlier, your coworkers who never served a day in their life, who don't have a family member who served in the military, they need to be aware of this. If you look at other incredible campaigns that have done a phenomenal job of creating awareness, raising money, whether it's cancer research or other big topics where we've made a big dent in, that's what we need to do around suicide prevention, and that's the goal for Be the One.
Wonderful. Well, Waco, you have partnered with other, leading brands and, financial and other. And now what makes American Legion sort of your go-to partnership for this? And what is it about that particular organization that you have decided that Be the One is the best fit to help bring that message to the American public at large?
It's a great question, because there's a lot of organizations that we can all align ourselves with. At the end of the day, we have a choice. And to me, some of the reasons why the American Legion is so special and why we're so well equipped to tackle this is it's a 103-year-old organization that's tackled some of the biggest issues historically facing the veteran community. The GI Bill, PACT Act. The most people don't know this. I didn't know this until year and a half ago. That initially in Washington D.C. we gave the American Heart Association their office space to get started, and we all know the huge impact that the American Heart Association has had. And so that's one aspect of it. But the other piece is that look at the resources, the infrastructure, the connections, and the how well the Legion is plugged into the federal government and all those relationships. We need to leverage those. We need to get a lot more efficient with those resources and make sure that they're laser focused on how we can make a real impact, and we're beating that drum and demanding that we do things differently. So that's a really important aspect of this. And then the other piece of it is the sheer number of the 1.6 plus million members that we have across the country. That's a lot of people that can affect a lot of change when we harness the total power of that. And the other thing is that look at so many of the amazing programs that the Legion does for children, for family members, for spouses. And again, I think that just really resonates with how we're going to, focus on this. One of the data points that doesn't get talked about is spouse suicide in the military. That's something that, we've got to think about as well. And, if we're only approaching this problem from just the veteran who served or active duty member transitioning out, we're not going to solve it. We've got to focus on family, kids, spouses, because guess what? What's going on in your household is going to impact your mental health. And if you're deployed or wherever, whatever's going on, those are the things that we need to take a holistic approach for, rather than just thinking that a suicide hotline alone is going to make a difference. It's not any one thing. It's going farther upstream so that we can ensure we create these design interventions for the service member who might be struggling with suicide or mental health issues, and also their family members. So those are all some of the reasons why I think that the Legion is such an extraordinary organization to support and work with to tackle, what is arguably the biggest issue of our generation.
And what other thought leaders out there or organizations that, if you have a vision for the future with, as the chairman of Be the One initiative, what would you like to see come from that? What partnerships and strategic alliances do you think that could really make a difference here?
Sure. So without naming names, because I'm a big believer in under promising and over delivering, I think we need to be looking more closely at brain health. We need to be looking very closely at alternative therapies that are out there that are being developed. The VA is doing a lot of research around that. Other organizations, Johns Hopkins, Stanford, and so on, are looking at alternative assisted therapies as well. So the clinical piece of that, the traumatic brain injury, the physiology piece of that impacts our behavior, our chemistry in the brain. And if we're not starting as far as upstream as we can go, we're setting so many people up for failure because we haven't actually diagnosed what the issue is. You could have all the therapy and all the access to care that you need, but if there's some underlying issue happening in the brain due to explosion, impact, whatever, we're trying to solve the wrong issue. So that is a really big area that I think we have a huge opportunity to lean into with academic institutions, other organizations that are doing a tremendous amount of research in this area. So that's a big area. Also, lifestyle brands that are out there. There are some amazing veteran-owned businesses that have done an extraordinary job. And they give back to the community in a whole host of ways. And I think that there are so many opportunities to align with some of those lifestyle brands that that will just continue to reinforce the incredibly positive message of Be the One. So that's another example. And then, like as I mentioned earlier, some of those key thought leaders from our community, there are a lot of them out there who have huge followings across social media. They have their own podcasts. And so us being able to collaborate with them and share what we're doing, share on the clinical side, on the partnership side, on the overall strategy piece of this, that's what's going to make a difference. And this isn't something that we're going to solve, in 6 months or a year. It's going to be, years in the making to really change how we approach this issue. And we're only going to be effective if we work with the most influential organizations that are there today, and also keeping our eye on those up and coming individuals and organizations that are going to be the 800-pound gorilla or the thought leaders in our community in the next 5-10 years.
Certainly. So really at the crux of Be the One, the message is that you or me, we can be the one to make an influence on one other veteran. So it just takes one person. And on the first of every month, you'd like people within the American Legion at posts around the country to kind of take that day and recognize it on the first of every month.
That's exactly right. And there's a lot more that will roll out that's more specific and actionable on that first of every month. But that whole notion of one and singularity, I think really gives us it. We have a tendency to want to boil the ocean as individuals and organizations, and starting at the most fundamental basic level is a really powerful thing to do that. And then let's let that network effect take hold and amplify that message, just starting, with the one individual. So we're really excited about what we're going to be rolling out, the different projects and partnerships with the posts, with the community within the Legion.
So now that we've just come off the annual convention where you had a panel lineup and lots of discussion about this, you want people to take home with them your message, your motivation, the momentum that was built around that can carry them through the year, and then some more throughout the year, what you're going to be leading that initiative.
Yeah, that's exactly right. And the beautiful thing about convention is it's such a huge opportunity to bring the Legion community together. And but also, it doesn't start and stop there. As you mentioned, once you go home, that's where we really roll up our sleeves and can do our work in communities. And the other thing is that, we need powerful partners in our communities. And the the I guess the beautiful thing about our communities is we operate all over the country. And you know who some of the largest employers are in all of those communities? Well, it's the healthcare providers. And we all know that we're dealing with a healthcare issue around suicide prevention and awareness. And so being cognizant of who's in your community, whether it's, if you're, in Cleveland, there's the Cleveland Clinic, in San Diego, where you are, there's Scripps. So in so many communities, big and small, regional and large national healthcare facilities, our community has relationships. And so, what can we do with those different groups to plug in a program like Be the One, so that the regional healthcare providers are helping to filter down that message to those communities? That's one of the most powerful ways that we can create messaging. We've got the national strategy and national programs that have huge visibility, but people get their information from a lot of places. And just because you might see something on an NFL game, for salute to service, and there's a call to action. There's plenty of people who don't watch football or didn't catch that game. And so again, being able to have a multitude of channels that we can engage with is going to be a really powerful mechanism for us to work closely with the Legion, with the Legionnaires all across the country.
Well, and some of your other strategic partnerships and your initiatives along these same lines involve the MCon. Can you talk what you've got brewing for that? It sounds very exciting. So tell us more.
Yeah, for sure. So MCon's really exciting. One of the things why it's really exciting is the American Legion is actually one of the founding partners for that event. And so MCon is a large scale consumer event that's designed to be a celebration of service and military culture. And so when we think about where we are with our community, we need to reshape the narrative around military service and what it means to serve your country. And so we're bringing together thousands of veterans over Veterans Day weekend in Las Vegas, and we're doing things that our community loves: outdoor and adventure, health, wellness, and fitness, a whole culinary component with whiskey and barbecue and other things are a lot of fun. We're going to have pro MMA fighters running guys and gals through workouts. We're going to have a archery competition, culture and learning, just amazing authors and actors from television shows. And so it's going to be, like I said, a true celebration of military service. And we're thrilled to have the Legion as a partner in that.
Wonderful. So it'll be open to all veterans, or anyone, really open to the public.
Veterans, active duty, military adjacent, so family members. The event is 16 and up, which is by design for young people that want to go with their parents who served or thinking about it. We think it's a really powerful opportunity from a recruiting standpoint. From a macro issue, part of the reason why we think MCon is so important is look at the recruiting numbers. We all know that they're down, pretty dramatically. And, this is not something that's just going to be solved by just having a conversation, recruiting in the same old way. We have to think about centers and communities of influence. The veteran who served. We've got to look at the coach that child is going to talk to, family member, whoever. And so making sure that their excited about that, and they're getting the real story of what service is about. Because, depending on where you're coming from, you're hard pressed to find another generational wealth changing opportunity when you think of military service. When you look at the hundreds of thousands of dollars that are available to you for the post 9/11 GI Bill, or you or your family, that's massive what you can do with that. And then the other skill sets that you're going to get in military service. And so, like I said, we really want to reshape the narrative around that and talk about, celebrate the amazing people who have served their country, because the vast majority of them are doing incredible things. And so that's, like I said, those are all huge goals for the program.
Well, wonderful. There's so many veterans out there who've broken that stereotype and just doing whether amazing things in business, in the arts, in financials, and showcasing all their great work, and for kids and inspiring patriotism to say, I want to be like her, I want to be like him, because they've gone on to great success. And those are some of the best motivators and recruiting ads you can ever make. Real life people who have gone on to leverage their military experience.
Exactly right. Exactly right.
Yeah. And so we're looking forward to that. And where can people find more about the MCon?
Sure. mcon.live.
Okay, perfect. We're gonna look
Is the
that
website.
up. Yeah. So before we go, though, I'd like to just offer up anything else you'd like to add or emphasize about Be the One. We're going to look for more. We'll have it in the show notes. But if you could leave people with just some final thoughts about what this means for them and how to amplify your message throughout the country.
Absolutely. So there's a few other threads that I think are important to call out about the Be the One overall strategy and our goals for this. I touched on the destigmatization piece and the different stakeholders we want to engage, but we're also looking at rolling out, suicide prevention training across posts and for members, and we're currently evaluating a whole host of different partners that we can collaborate with on that. Again, that's incredibly actionable at the local level. Think globally, act locally, and that's a very important thing across all the different communities where veterans live. So that's something that's going to be really compelling. Clinical research is also something that we're really excited about, how we're evaluating opportunities around that. When we think about, there's hey, what we want to do, but efficacy is everything. So it's great if we think that we might, have this great program, we want to roll it out. Well, what's the efficacy of this? Like, why are we leaning into one thing versus another? So data measuring, the impact of those is really important. Part of the reason that I think, I love the analogy of, I don't know if you've anybody who does laps, swimming in a pool. You've got 8 lanes, and we've got, lanes 1, 2, and 3, are doing well. We've got the appropriate number of stakeholders, whether it's private sector, VSO, government entities, swimming well over there. It's a well-oiled machine. No one's running into each other. And then in the middle, the other 2 lanes, they're empty. Like, no one's even in those lanes addressing these issues. And then the other lanes to our right are clogged with so many VSOs and DoD organizations and the VA and programs that we haven't been communicating together. So all of those efforts, people are bumping into each other. There's water going everywhere. I'm Michael Phelps in one of those lanes, and I can't actually swim as fast as I can because of the inefficiency that's happening over there. And so as a community, it's really important for us to think about how we can collaborate so much more efficiently so that we can tackle this problem. So that's a big part of how we want to engage, the community in a whole host of different stakeholders. So that's like I said, that's one big thing that I wanted to leave you with as we think about engaging, our community and working closely with the military.
And there does seem to be a lot of noise out there and resources at every turn, but the American Legion is now going to emerge as a leader and with that voice and that strong following, with some really key people and partnerships that we just haven't seen before. And so now taking the lead to really synthesize all the information and make resources available for folks.
That's
So
correct. And that's what we want to build on the incredible work that the American Legion team at national and regionally in the posts and in the states have done, and we want to build on that legacy and really, just like I said, continue to do extraordinary things as we've done in the past. So that is our goal, is to continue to shine a spotlight on that and make a huge difference.
Wonderful. Well, there's no shortage of people out there who want to help. And we're going to put in the show notes of where people can learn more, get in contact, if they want to volunteer, if they want to partner, because I know there's a lot of people with a lot of influence out there who really are just waiting for the right moment and the right strategic partnership. So we look forward to hearing from those folks. But we sure appreciate your time today. It was such a great conversation, but we're going to continue the conversation and we'll check back with you and find out how things are going to be able to amplify and really focus in on this message. So Waco Hoover, thank you so much for joining us for the first Be the One podcast under Tango Alpha Lima. So thank you so much.
Thank you, Amy. Appreciate it.
Okay, thanks. And thank you, Alphas, for tuning in to the Tango Alpha Lima Be the One podcast. Remember, you can be the one to save one veteran. Find resources and more information at betheone.org and connect with the American Legion on social media to keep the conversation going. Don't forget to subscribe to the Tango Alpha Lima podcast on YouTube, Apple Podcasts, Spotify, or wherever you find podcasts. And please share our podcast with others. And we'll see you next month. On the first day of every month, American Legion family members are encouraged to wear Be the One apparel to publicly show their commitment to reducing the stigma around mental health issues. Go to betheone.org to learn how you can be the one to save one veteran. If you're a veteran in crisis or concerned about one, call the Veterans Crisis Line at 988 and press 1. You're not alone. The Veterans Crisis Line is here for you, and you don't have to be enrolled in the VA. Help is available, and speak with someone today.